Okay, if you're listening or you're watching, you got to this point, we're going to be talking about GLP-1 agonists and how important they are and what they've done, but also the potential side effects, because we've had a lot of patients come in with side effects here and they think they're training and doing resistance exercise. And that's what I love about the DEXA is because at the end of the day, and maybe you can answer this first before we get into that, we should be talking about fat loss, not weight loss. And
Yep.
is it something of a terminology that we should really sort of stand for? Words develop culture, words develop thinking, really important what you say. So maybe give me your first sort of thought on fat loss versus weight loss.
You nailed it, man. Like it's not, I think we're all just used to saying weight loss. Like it's, that kind of term has been around forever. That's what we associate but no, certainly it is fat loss specifically. We do not want to lose, again, we talked about this, 20% of that weight loss typically is loss of muscle, 80% fat. Especially on the GLP-1s, 30 to 40% of that weight loss is going to be loss of muscle potentially if unless you're doing it right. So yeah, it's about fat loss. It's not weight loss. We don't want to lose muscle weight. We want to lose fat, like weight related to fat.
Okay, so give us an overall view, a sort of a stratosphere view of GLP-1s, your experience with them and the benefits and the possible side effects.
Man, these are the most wonderful medications. Like I can't even explain. I don't, unfortunately, I think there's a lot of misinformation out there. There's a bad, almost like there's a stigma associated with taking a GLP-1, like you're cheating or this and that. Like I disagree. Like I really truly just having practiced for many years and having seen, in the metabolic health space and obesity medicine space, what the tools that we used to have and then what we have today. I mean, historically, like like the medications we prescribe for weight loss, orlistat, for example, which causes a ton of diarrhea. It's very, in terms of its like weight loss impact, it's modest. It doesn't have like the certainly the compelling endpoints that GLP-1s have, and yeah, it's cheap, but it doesn't work, and most people don't tolerate it well. Or like phentermine, the cardiovascular implications, and you've heard of fen-phen, and that gets a bad rap, understandably. I mean, it could be a good option for some people, but it could raise blood pressure. It's a stimulant, people get addicted to it. It could be abused, Qsymia, in a similar vein, that being phentermine topiramate, which is a combination medication FDA approved for weight management. And then Contrave, bupropion, naltrexone. Again, these medicines work, but they have a lot of undesirable side effects. They're not really optimizing your metabolism in a sense. Like, yeah, you're losing weight, and part of that, of course, is fat mass loss. But the GLP-1s has just changed the game. They literally have changed the game. These are what we call highly effective anti-obesity medications because we were talking around, more than 15% on average weight loss. Um, some of the earlier GLP-1s that came out, and of course, there are oral versions of them, but really for weight loss, we're talking about the injectables, and these are subcutaneous injections. You're injecting them right under the skin. The first GLP-1s that came out, they were dosed, in fact, even multiple times a day. And then they came out with like the daily liraglutide dosing. And then subsequent to that, semaglutide, once weekly dosing. But that was, only acting on the GLP-1 receptor. And then we have like the tirzepatide, which is acting as a dual receptor agonist on the GLP-1 as well as GIP receptor, resulting in, 20% more potentially weight loss with and by working synergistically on those two receptors, potentially less side effects, less gastrointestinal side effects. And we'll talk about side effects of GLP-1s, but the evidence is clear. These are highly effective medications. They result in the most robust weight loss. In terms of their safety, I think they're the safest ones available, quite frankly. If you start comparing them to some of these other options and some of the side effect profiles, like they are safe. They've been used for years for type 2 diabetes. So it's not like, people claim, oh, these are newer drugs, and they are to a certain extent, but they've been studied for a long time. And, again, type 2 diabetes have been around. And so And we're finding more and more other indications. We're seeing cardiovascular outcomes significantly improved. We're seeing improvements in kidney function, fatty liver disease. They got FDA approval for fatty liver disease, obstructive sleep apnea. I mean, the list goes on, and I think we're going to continue to see benefits beyond even perhaps. There's emerging evidence about its impact on reducing alcohol use, potentially improvements or mitigating things like dementia. And so I think the verdict's still out in terms of like what benefits now. And I don't think these are for everyone, by the way. Like I see a lot of people because I don't know, maybe it's just a trend. People that are not overweight or that don't have overweight or obesity, they're starting to take them. I think there could be a place in terms of longevity, almost like a metformin. I think the evidence is still we have to see. But in my experience, anecdotally, the individuals that, let's say, don't have at least overweight or maybe some comorbidities associated with that, they tend not to even tolerate it that well. Even if you microdose them, like it's not necessarily. I think for those people, actually, lifestyle, the diet, the exercise, and all that could go a long way, and they don't necessarily need the medication. But for those that have overweight with, let's say, comorbidities or and not necessarily strictly following the BMI criteria, because as we know, like body composition is important, fat mass, and all that. So you want to really make it a personalized choice and have a discussion with the individual, and shared decision making is super important. But for those that have overweight, obesity, I mean, this is a game changer. It's literally it's what is their other option? Let's say someone has severe obesity, bariatric surgery, right? Which is super invasive and it is effective. But gosh, did you really want part of your stomach cut out and like your intestines kind of rearranged and like I don't know. That's a pretty and so I think having this tool with the GLP-1s and seeing so robust of like weight loss outcomes and some of these other benefits like the sleep apnea, fatty liver disease, and kidney disease, it's exciting. This is an exciting time. We are going to start seeing even more effective medicines, less side effects, more kind of convenient dosing. Today a lot of people are, of course, stuck with like weekly dosing, but there's a pipeline. We're going to start seeing monthly dosing of GLP-1s. We're going to start seeing, some people have needle aversion. They don't want to inject themselves. We're going to start seeing oral versions. There's a lot of compelling research being done right now. We'll probably start seeing even more robust weight loss outcomes, combinations where it's mitigating muscle mass loss. Again, less GI side effects. So like, yeah, it's a very exciting time, I think, in metabolic health and in obesity medicine, certainly. Um, in terms of side effects, I think that was another question you brought up. So, gastrointestinal side effects are certainly the most common. Nausea being seen, mild to moderate nausea, and up to, let's say, like around 50% of individuals experience that. Now, if you start with microdosing or personalized dosing, like I think that could help mitigate that, and that can go a long way. And that's something that I implement in my practice. But outside of the nausea, potentially like abdominal discomfort, diarrhea, constipation are possible. People could potentially develop gallbladder disease, like gallstones, especially if you're losing weight too quickly. You want to be very careful. Really aim for, let's say, around 2 pounds a week on average for most individuals. And of course, if you're under medical supervision, you could probably be a little more aggressive with that. Um,
What about the
but
cancer risks, the thyroid cancer and the pancreatitis and pancreatic cancer?
Absolutely. Yeah. Yeah. So the thyroid cancer thing, so we're talking specifically about medullary thyroid cancer. Also, there's a condition called multiple endocrine neoplasia type 2B. So these are contraindications to taking these medications. If you have a history of these, or if you have a close relative that has these, yeah, you definitely should not take them. This is just a precautionary measure because when they studied this in rodents, they found that there was a higher propensity for them to develop these conditions, but this hasn't been shown in humans. And so, yeah, I think anytime you make a decision to, let's say, start a medication, and I don't think medicine is for everybody. Again, you always want to weigh the potential benefits, the risks, and alternatives, right? So maybe you've tried dieting and exercise, and you've tried all these older ineffective medications, and they weren't for you, and like you don't want to do bariatric surgery, and again, like maybe the GLP-1 is the right option for you, but maybe it's not. Again, if you have a history of that medullary thyroid cancer, it is absolutely
Mm.
not. Pancreatitis, it's not a hard contraindication to take it, but certainly, if you have a history of pancreatitis, you got to be very, very careful. But it's not a hard contraindication, and certainly, pancreatitis could potentially occur. Even if you've never had it before, like on the medication, you have to be careful. So, yeah, these are noteworthy potential side effects. We always hear now, more recently, about the eye conditions, particularly if you have like type 2 diabetes. But there are a couple of different um, eye diseases that it could potentially exacerbate, and so you got to be careful there as well. But in most people, like if you have type 2 diabetes and you're on the verge of developing diabetic retinopathy, I mean, the idea is that this is supposed to help you. I mean, it's optimizing your blood sugars,
Mm.
it's optimizing your metabolism, you're losing weight. So for most people, it's actually helping them. It's not harming them. But we do have like case reports, and I think a very small subset of individuals can have like serious side effects. But as long as you're being monitored, you're
Mm.
working with a doctor. Fortunately, as you probably are aware, like there's a black market. People are buying these meds like just
Yeah.
they don't know where it's coming from. It's not regulated, and who knows? They're compounding this stuff, and I think there is a role for compounding. I mean, now it's illegal in the states, and like you got to be very, very careful. I really do advocate for using the brand name medications, and so yeah, it's a crazy world out there. You got to be
Yeah.
careful. You got to again work with a trusted physician. I would highly encourage that. Make sure you're going to get prescribed, get those labs, get your body composition checked, your DEXA scan. Even work with a dietitian, work with that personal trainer, even a health
Mm.
coach. I think all of these are important, and I think it's
Mm.
about that personalized experience, and kind of working with that individual and what kind of resonates with them.